All right, folks. So stomach acid today is our topic. Is that a friend or a foe? So many people struggle from reflux disease, heartburn, stomach ulcers, duodenal ulcers, esophagus ulcers, and they say, oh, it's the enemy. But what is going to happen if we don't have stomach ulcers? We'll all be happy. But if we don't have stomach acid? So, Yvette, what do you think? Stomach acid, friend or foe?
I think that's such a brilliant question because we demonize the things that we really need, and then we seem to absolutely, glorify the things that we don't. Stomach acid, definitely your friend. It is a very common phenomenon for people to say things without thinking, and I'm guilty of it. We're all guilty of that. But one of the statements people love to make is, I got this extreme upset because my stomach acid is too much. And I always want people to stop and think, well, what do you mean by too much? Your body's producing that for a specific reason. But today, you and I are going to just have a little bit of fun and explain to people why stomach acid is so important. And then the next time when you make that statement, you're going to stop and go, oh, hang on. It's not really the too much stomach acid. It could be maybe too much of the other junk that my body cannot utilize.
Yep.
So, Johan, a couple of things that might come to mind for you first when you think of somebody that take a medication or want to eliminate the production of stomach acid. What is the first thing that you think they're going to experience, besides the fact that, for a short while they'll have that discomfort or the burning gone? But what will be the benefits, you would say, or what's going to be the side effect of not having stomach acid?
I want to say for the short term, for a brief period of time, they might get relief of their heartburn. That is a given. But think about the long-term downstream effects. What is going to happen if you stop your stomach acid production? There are things that your body is not going to absorb that you need, especially in the form of minerals. There are things that your body is not going to make because stomach acid is very important in unraveling a long chain of amino acids so that you can chop it up and use it for different things. If you don't have that stomach acid, you might not use or make all those different proteins and things that you need in your body. And there's a big chance you also might not have enough vitamin B, although the vitamin B is not directly the stomach acid, hydrochloric acid. There's actually something else that gets secreted by the exact same cell that you're blocking to make the stomach acid. It's called intrinsic factor. And without intrinsic factor, you can forget about absorbing vitamin B12. So from your food or a supplement, it's not just from supplements, so you can supplement all you want. You're just going to create expensive pee, or poop for that matter, because it won't get in your bloodstream to get into your pee for the first while.
Honestly, it goes to the basics where you and I always go to, is the common sense question. We've spoken about cholesterol. If it's so harmful for you, why does your liver produce it? So if the stomach acid is so bad for you, then how come your stomach produces it? And I think there's such a big disconnect in the medical world these days. You and I love to talk about the Band-Aid. So when you drive the car and the red light goes on and say that you have no oil or no gas, we just put a Band-Aid over it, because if you don't see it, you won't have it. But now in the case of stomach acid, it's a little bit of a different story, because if you go and block that production of the stomach acid, which is essential, like you said, for absorption and utilization of nutrients in the sense of hormones and then your fat-soluble vitamins and that. But then downstream, you start having other issues. And something you mentioned right there was with the vitamin B12, or your vitamin Bs in general. So if you don't have the acidic environment, the intrinsic factor, you can supplement till you pink in your face. It's not going to make a difference. But there's also going to be downstream a lot of other effects. For example, you were talking earlier about how not having stomach acids makes it hard for the body to digest food. Can you explain us a little bit on that?
I think one thing just to also explain is there's a chemical term that we call pH. and it stands for percentage hydrogen. And usually if you think, oh, if your pH is high, you've got acid, that's the other way around. The lower the pH value, the more acid you have, and the higher the pH value, the less acid you have. The perfect environment for your stomach is actually a pH between 1 and 3, which is pretty acidic. It's really acidic. I remember in a metal shop in school, we would use hydrochloric acid to clean our metal objects that we're going to solder, and the pH of that hydrochloric acid was 1.2. If you see what it does to a metal object, you think, oh man, is that what's going on in my stomach? Crazy. But think about, and then you think, well, if it is that acid, how come does my stomach not get damaged automatically? Shouldn't we shut it off? Because it's going to burn a hole in my stomach? But God made our bodies perfect. So there is cells that actually produce a thick mucus lining in your stomach that protects your stomach, the actual membranes, from that acid. And that mucus is actually very alkaline. It has bicarbonate in it to balance it out. But when the acid actually gets secreted, it actually lies on top of that mucus membrane. So think of it, it's amazing how our bodies work. So if you think about when does the acid get secreted? Only once the food hits your stomach? It actually starts by sight and smell of the food even before it's in your mouth. So if you're going to smell and look and drool over food, you better eat it because you have to get that stomach acid something to do.
You know, I like to explain to people in a very simple way to understand when they eat their food. Just like you said, when you see food, when you smell food, the body starts reacting. When you chew the food, because most people will now say, okay, it's so acidic. So we both know that there's that little valve at the top of the stomach. So when we eat our food and we swallow it, the little valve opens up, the food is in there. But that little valve is very much controlled also by the acidic environment and also by the food you eat. And believe it or not, but foods that are higher in carbohydrate content has less of an effect for the little valve to close versus protein and fat. And this is something the scientists noticed when they gave the people the food and saw that the little valve does not shut close so much. So now we have a food that's eaten, goes down the esophagus, in the stomach. It's in an acidic environment. In that acidic environment, the little valve closes. Otherwise, your esophagus is going to rupture. We don't want that. And we are not talking about the once in a million illnesses or diseases or genetic, disformations you have. We're talking about just basic biology. When you eat, that happens and how that proceeds. Your body naturally protects itself that acidic environment will not affect your esophagus. But one of the most important things that I really, really think is so essential for people to know is that's actually your first line of defense.
Mm-hmm.
Because if you eat a poisonous thing, if you eat something that is not good for your body, if you eat something that is actually going to be harmful, it's interesting how God made our bodies that you'll have that projectile vomiting. It'll hit the stomach and the valve goes and it's out. And if you've ever had projectile vomiting, you'll understand that it actually can save your life.
Yes. And that's the other thing also, talk about the protection of your body. The stomach acid is super important for you. Now, I guess everybody listening to us have heard about the 5-second rule. I don't doubt that for a moment. One of the major important things that the stomach acid do is to kill pathogens that you eat. So if you don't have enough stomach acid, if you eat something, if the 5-second rule, okay, it's clean enough, just chomp it down, and you don't have enough stomach acid, you're not going to kill the bacteria that might have jumped on that piece of food that you're eating right now. And none of our food really is sterile. And for a great many of us, we believe that it should not be sterile because if we live in this sterile environment, we will never train our immune systems to actually do something. So that's another important function of your stomach acid. So why do you want to shut down your defense mechanism? It doesn't make sense. We're talking about average, general, healthy people. They don't have any deformities in their GI tract. There's no permanent damage, because now if you eat a food or anything, if you do anything in your life that is going to decrease your stomach acid content or quality, and that sphincter don't close as good as it should, now you are going to have gastric reflux. Now the stomach content may push up into your esophagus, and it's going to be pretty uncomfortable for you. And over the long term, that can cause a lot of damage, where in future you might have permanent damage. So I think it's 6 of one and half a dozen of the other, is to make sure that you treat your stomach with respect.
Exactly. And I don't know if you can remember from pharmacy school, Johan, I'm always very much strong about how the body will always try to return to its normal. It'll return to the way that God made it to be. And I remember in pharmacy school when we did the tests on the intestine of the rats with regards to acid and alkaline features. And the same with humans are that if you take that acidic environment that should be acidic, and you keep giving it an antacid, meaning you keep pushing it up to a higher pH to make it alkaline, believe it or not, that the result is that the acid production gets more and more because it wants to restore, because that is the place where the body functions the best, when your stomach is in an acid environment, because that's your first line of defense that fights pathogens, that fights organisms, that helps the body break down your foods in the right way, helps your minerals and nutrients be absorbed. And it was always interesting for me how that little graph where the pH level was, it was low. Give it the antacid, it goes high, and then it goes lower than before. It goes high and lower than before. So in the long run, yes, you could have a lot of discomfort. There could be some biological, physiological issues, but all of those can be solved if you look in the right place.
Yes.
But by closing the tap to block off the acid production, yeah, in the long run, you're going to struggle with some stuff. You mentioned earlier on about minerals, nutrient deficiencies. You know, those things impact not just your food production as such or your food absorption, but in the long run, Johan, you and I see things that become serious health-related issues. Speaking about the vitamin Bs, anemia.
Yes, absolutely. And talking about anemia, if you don't have enough acid in your stomach, apart from the vitamin B12 that helps with building blood, your iron absorption is also really low if you don't have enough stomach acid. And one of your best sources of iron is not actually a supplement. It's actually from eating red meat, because the heme iron that is contained in red meat is way more absorbable. But again, if you don't have the acid in your stomach, you might not absorb enough quantities of it in order to build your blood. And therefore, you can have not just a B12 anemia, but also iron deficiency anemia. So there's a lot going on with stomach acid that is actually benefit for you. And another benefit is when you eat a protein meal. A protein is actually a long chain of amino acids that's just stacked up against each other. And if you look at a protein of whatever sort under a microscope, it looks like a ball of yarn that is clumped up and it sticks together. Now you need hydrochloric acid in your stomach to break that stickiness in the ball of yarn, to make it one long piece of yarn so that it can be cut up in smaller pieces. Another thing that gets excreted in your stomach is a product called pepsinogen, which is an inactive form of an enzyme called pepsin. And pepsinogen only gets activated if you have enough hydrochloric acid in your stomach. So You can't get the scissors out and sharp to cut that long string of amino acids into absorbable little pieces if you don't have enough acid in your stomach.
That is really a good way of looking at it. And you also mentioned something we always speak about is the impact of the acidic environment on your nervous system. Can you explain a little bit more there? Because that's very important.
Yes, it's actually the other way around. Your nervous system has an impact on your acidic environment.
Wow.
There is studies that show people who have anxiety, depression, or constant negative thoughts decrease the quality of acid in their stomach. In other words, the pH goes up. Now think about this. We know in biology we have our nervous system. There's a central nervous system, which is your brain and your
Like your
spinal cord. Yeah. And then you have the peripheral nervous system, that is the outer nerves. But you also have in the same nervous system, there is the sympathetic and parasympathetic nervous system. Now, the sympathetic nervous system is fight, flight, or freeze. So that is a nervous system that gets activated when there's something putting you in danger, when you're about to fight, when you're stressing out, when you're about to get in a car accident and you need to make a quick maneuver. That's your sympathetic nervous system. Then there is a parasympathetic nervous system, which is responsible for rest, digest, and repair. We as humans are not supposed to function only in the sympathetic nervous system. You always have, it's got to be there, it's got to be active when you need it. But it doesn't have to be always on. So the parasympathetic nervous system creates a good environment for your body to slow things down, to digest your food, to take that food that you've eaten, put it in usable building blocks, to repair, especially if you're going to the gym and you shredded some muscle. Now you have that building blocks to repair that muscle. But if you're constantly stressed out, depressed, have anxiety, or all these negative thoughts in your head, parasympathetic nervous system is not that active, because the sympathetic nervous system overrides it. And one of your favorite topics is the homeostasis, the balance in our bodies. Now, sympathetic and parasympathetic has to be balanced. But if you're always stressed, not that balanced anymore.
You know, it brings back a word the old people used to use, and through the years that people used to make fun of that word. And they used to say you have a nervous stomach. I don't know if you remember that. And a lot of the older people used to say you got a nervous stomach. But medicine has explained that away and said, oh, no, that doesn't exist. But that's exactly what you're explaining.
For sure. Because if you ever heard the saying, I've got butterflies in my stomach, or I've got a knot in my stomach, all those conditions actually explains a nervous or an anxious state. And that nervous and anxious state, yes, you actually feel it in your gut. Because what we do as functional medicine practitioners, we look at the whole body. We don't just look at your stomach. We're not specialists in the sense that, we're going to see that we only look at your stomach. We're not specialized that way, because we feel if you stub your toe in the morning, your whole body responds. There might even come some words out of your mouth that is provoked by emotion. And so the whole thing works as a unit.
Yep.
So if you're emotionally in a terrible place, there is a chance that your stomach acid might not be between a pH of 1 and 3, which might mean that you're not going to digest your food the way it should, which might mean that you might complain about a lot of stomach issues, especially after eating.
And you know what's very interesting, because I've actually seen this phenomenon in people with this nervous stomach, the butterflies in the stomach, the upset stomach, in state of times when they've had very big loss and major I wouldn't, maybe anxiety, but like loss of a family member, loss of a husband and a wife, and then they develop this extreme pain in their stomach. What you were saying there is this is the nerves, this is nerve related, and then that affects the production of the acid. So where these people are mostly given to calm them down, they'll give something that works on the GABA center or something in the brain, that's detrimental.
Yeah, for sure. And most of those things are highly addictive, as you know. And do you really fix the problem? I don't think so. Because now, instead of giving that person some coaching on how to deal with the situation that they're in, which I think would long term benefit them more, because also now they won't have gastric issues if you teach them how to deal with it. Rather than popping a pill, and you mentioned it at the beginning of this podcast, slapping that Band-Aid on the low oil light in your car. It's not fixing the problem. You just don't see it anymore.
Now, we ask ourselves, how come it's such a very high incidence that this is happening in today's day and age, that so many people are struggling with indigestion, so many people have gastroesophageal reflux disease. And, we love to give things these diagnoses. Why do you think we have so much more of that now than we had, say, 60 years ago, 50 years ago?
My opinion, I do think that there's a lot to do with our rushed life and that we don't make time for ourselves. And there's a lot to say about, because everybody wants to go for the quick fix. And we have a friend who talk about the thumb suckers, and it's easier to just pop a Tums in your mouth or whatever something there is to bring you that instant relief rather than looking at what the real problem is.
That is so true.
Because we don't want to take the time to cook a decent meal, for one thing. We want it on the go. If we wait more than 5 minutes at McDonald's, we're upset. And if there's an emotional problem or a relational problem, it's much easier to pop a Xanax or something else instead of sitting down and dealing with a problem.
You're very right in the fact that the lifestyles, the food choices, I do believe a lot of the changes started happening in the GI related stuff when we started incorporating foods that are literally not human appropriate food.
For sure.
I will say this till the day I fall off my chair and I don't teach people anymore, but seed oils, extremely harmful to the gut. It also does not create the correct environment for everything to function. I also believe we've demonized salt. And if you know anything about biology, biochemistry, or chemistry, you need salt to make hydrochloric acid.
Yeah, absolutely. If you think about that, because what is hydrochloric acid is one atom of hydrogen and one atom of chlorine. Now, what is salt? Sodium chloride. So without the chloride part of that salt, what are you going to make? You're not going to make hydrochloric acid. That's
Exactly.
for sure.
And then what you were saying, if you think about it a little bit further, you're encouraging people not to eat salt. So then we've already got a complete dysfunction in the gut because there's not enough salt to make your hydrochloric acid. That interferes then, what you were saying, Johan, with the gut-brain relation. I have learned of people, and I know people who cut out salt to such an extent that they were going to go mad. In fact, I know somebody who was in a sanatorium for 5 years for not eating salt. So you look at all these things and you slowly but surely start putting the picture together. We started adding seed oils after the Second World War because we didn't know what to do with it because there was no more war. So we needed to feed it to the people. So the food war started. So we tell people salt is bad. We overeat all these over-processed. You and I spoke about the breakfast cereals, these things in a box that not even the rats and the ants will eat it, but yet we eat it. So now, all of a sudden, the ratio of imbalance of carbohydrate, protein, fat that our gut is supposed to work on is way out of whack.
Definitely.
And then the kids, younger and younger and younger, get fed Pop-Tarts and waffles and things like that for breakfast. It's not a breakfast.
No.
So as the time's gone by, we've really just completely messed up the DNA of our stomachs plus our kids' stomachs and their children. So GI-related stuff like reflux seems to be starting earlier and earlier.
Absolutely. And I honestly feel I'm not a pediatrician to tell parents what to feed their kids. But I think there is a lot to say about introducing animal products. Because as you know, many plant products have a really high pH. And it does not take a lot of stomach acid to digest it. It also does not stimulate stomach acid to be released. This stimulates the stomach acid to a certain extent, but not nearly enough that is useful in order to get the nutrients out of it. So the more we eat these processed foods, the more we tell our stomach, you don't need to produce that much stomach acid anymore.
Takes the path of least resistance.
Yeah. And if you think about certain plants that have the oxalates and the phthalates in it, you need the stomach acid, as we said, to absorb your minerals. But now you don't have the stomach acid to get the mineral out of the plant, and the plant has oxalates and phthalates in that hold on to it even more.
Mm-hmm.
So now you're in a catch-22. What are you doing with it? Why are you eating it? Because you really get no benefit from it. Whereas if you eat animal product, even eggs for that matter, can stimulate quite a decent amount of stomach acid in order for you to digest it and break it down into a usable form.
And I think a very good way that you and I really learned, if somebody wants to argue, no, stomach acid is not so bad for you, when majority of the people in the case of reflux and GERD, when they go to the doctor, they get given a product which is a proton pump inhibitor, which we're not going to do a whole pharmacology class on it, but it just prevents the actual production of acid in the stomach. So with the amount of people that are going on those kind of drugs, that's where Johan and I started seeing, but hang on, if you are on this medication, you seem to lack magnesium, potassium, sodium, and then we start going down the line. Then people start having very low iron. They got all the vitamin B deficiencies. So if you want to question why we say acid is so important, go cut it off and go see what you end up with. And in most cases, it can be a couple of months, but in a lot of people, it's maybe a year or so.
What we've seen, Yvette, and you can attest to this, there's so many people who take these drugs lifelong. Even if you go look at the package insert, the manufacturer will tell you that you should not use it for longer than 2 weeks. But they're on these drugs lifelong, and now they can't get off it. Because the moment they stop, they get rebound reflux. And it literally feels as if they're going to die, if they're having a heart attack.
Now, people actually end up in the emergency room with a diagnosis of a heart attack to eventually find out it was this reflux. So when people are on these, I always tell them, please do not stop them immediately.
Yeah.
You're going to hate me. So no, don't do that.
There is a way to get off it, but speak to us on how to do it. You don't just stop it cold turkey, because you will regret it. And talking about these long-term, Yvette, what is one of the number one side effects mentioned? Osteoporosis.
I was going to say the bone fractures.
Yes. And what do they give to prevent osteoporosis? Alendronate, which you already are taking the PPI to prevent the gastric reflex. Now they're giving you something for your bones that is going to cause gastric reflex and damage to your esophagus. So don't you think it would be better to just not start on the proton pump inhibitor in the first place?
It definitely would, because if we take it 2 steps back and we say, okay, fine, if I have an acid environment and my body is able to absorb the fat-soluble vitamins, the A, D, E, and K, and then with that, my body is able to utilize calcium, because when you do have the acid environment downstream, your calcium is better absorbed, so your bone resorption is better. You've got the vitamin K that you need for that. Then all of a sudden your bone density does not go down. So instead of going the route of forcing the body to like try and rebuild the bones, which is detrimental because one of the top side effects there is bone fractures, which is hilarious, then you should rather not go onto something that stops your stomach from preventing acid. Or if you do go on something like that, have an action plan, because like Johan said there, I studied that piece of paperwork, and that when they designed that, they said 2 weeks, sometimes maximum 6 weeks.
Yeah.
And then get off it. And then you have to have an action plan. But in most cases, it comes back to what you said earlier. Life is busy. We don't want to make lifestyle changes that could actually be permanent, because for some of it's very hard to make a change.
Yeah, absolutely. And especially if you're out on your own and you don't really know what to do, you rely on Dr. Google or Dr. YouTube. And then you have all these contradicting views that tell you all these different things. And in the end, it's sometimes easier just to do nothing.
Or just stay on the drug. It's just much easier. Deal
Yeah.
with the problem later. And I understand why people feel like that, because I always have to remind Johan how much he knows and how much we think other people know, but they don't, because we don't know what we don't know. And unfortunately, we're trusting people to tell us the truth and have our best health and our best results at heart. But honestly, they only will give you advice as far as what they know. So it is really hard, and I'm not giving anybody, putting any kind of blame on you if you are on PPIs and medication like that for reflux, because it's extremely hard to try and navigate this thing alone. That's why we always encourage people, reach out to us. We can help you. We've seen the effects of what it is like if somebody takes a PPI for a very long time. Studies have shown the bone fractures and how that increases. And now, of course, also with a cognitive decline, the amount of people with dementia and all the related cognitive issues all correlates back to that.
Yeah.
But then the big question is, Johan, people ask, well, how do I get my stomach acid to function normally? How do I get this to work well? And I think that is where there's a very big disconnect. People don't know how to do that.
That is true. One thing that I found useful, especially for people who have not been eating a human appropriate diet for a long time, and because of that, their stomach acid is not in the quality that it should be. I really think there's a lot of value in supplementing with whole food minerals to start out with. And I would say there's a combination. It's not just supplements. You have to change your lifestyle too. You have to stop eating the food that is actually damaging. That's number one. And like we said, don't stop your stomach acid medicine cold turkey. You have to gradually lessen it as you increase. There's actually a multiple factors that you have to incorporate in order to get off of it. But it is possible. It's 100% possible.
And I think that's why it makes it so hard, because it's not just one prescription I'm going to give you and say, do this and that will be better. But you actually have to look at your sleep. You actually have to, like I was talking about the fats. Butter is such an essential good fat that it's got the right omegas in it. It's got butyric acid in it. It's got things like that to help the gut. If you don't eat that, it doesn't have the building blocks. If you eat too much processed food, so we've got to get you back in eating human appropriate food, and then slowly but surely go lessen off the medication. But if you can't do it yourself, give us a shout.
Yes.
Ask us how. We can walk you through that. I've helped numerous people, Johan and I both, how to get off the PPIs, because in the long run, the side effects associated with anything that blocks the stomach acid, and we're not just talking about PPIs, but anything. Like Johan said, if you're popping Tums the whole time, you don't have a Tums deficiency. You've got a complete messed up metabolic system.
Yeah.
And
That
when you
is
get
true.
that, yeah, when you get it fixed, you feel better, you look better, your skin will be better. Yeah, that's one thing too. And what I wanted to mention, didn't think about that earlier, is a lot of people have asymptomatic dermatitis, and this comes out in the form of what we all know, eczema. And when you start reducing all the foods that are causative of that, and you increase stuff to help with the stomach acid, help with the fat soluble vitamins, their eczema goes away. Isn't that just
Yeah,
amazing?
absolutely. I've personally seen that, and it is unbelievable because, firstly, when you have that consultation, people think you're nuts. How? It's my skin, it's the outside of my body versus my gut, that's the inside of my body. But they are virtually almost the same tissue.
Mm-hmm.
In the embryo, it is the same tissue. So if you think about that, there is such a close relationship. And like Yvette said, the seed oils, when you have eczema, that's the first thing that you have to stop, completely eliminate out of your diet right away. 100%. That is dangerous to you. So, but what I wanted to say also, Yvette, you mentioned get help. Our links is always posted in the show notes. Click on our calendar link, make an appointment. Let's see how we can help you.
And what you were also referring to with a supplement-wise, we can go through for people because you can quickly see, what nutrients and minerals you'll be deficient of. And Johanna and I love to use things like apple cider vinegar, things like that to incorporate in your diet to get the body to work and function the right way. And once you start doing that, then all of a sudden that nervous stomach, that anxiety, that gets better. You will feel better when you've got the right nutrients. But again, if your body can break it down and use it. So in our whole discussion about is stomach acid a friend or a foe? Yes, it is your absolute essential friend.
Yes, that is so true. And, I know we're heading towards the end, but I do want to mention something. You mentioned something about sleep. And if you have a problem with sleeping and now you go to lunch and now you have stomach issues, those are related because if you don't get good quality sleep, your parasympathetic nervous system does not get activated in a good enough way in order for your stomach to digest, rest, and repair. So no wonder you have a problem with gastric reflux. And if you have a problem with sleep, we can help you with that too. As a matter of fact, I've got a family member who called and said, I've got a problem sleeping. I only fall asleep by 1, 2 o'clock in the morning. And then I have to get up early. And the simple thing like magnesium fixed that problem. Obviously, how long have we been preaching this, Yvette? Forever. So until you have the problem and test out some of the strategies that we mentioned, you're not going to know.
Yeah, it reminds me of a patient I dealt with, I think about a week or so ago, where a whole bunch of health-related issues, including erosion of the esophagus, having involuntary muscle movements of the legs and twitching of the eyelids, and having had 5 or 6 surgeries to fix this, that, and the next thing. And I sat, and this patient is about 50 years old on 17 different prescriptions. And I asked, have you ever been given magnesium? And when you look at the neuroscientist and the neurospecialist and the neuro this and all that, I thought that's a given. No, nobody's ever mentioned that. And it was heartbreaking because I've seen in people that we've worked with that, again, if you give them the right nutrient, there's certain things with regards to muscle, sleep, many functions where the magnesium is needed. So it's a smaller little thing as that can make a huge difference.
Yeah.
And again, the food we put in here, people sometimes, they don't realize what damage they make with the food they put in their mouth and think your stomach is just going to digest it. What if it doesn't have the right things to do it?
Absolutely. Because if you eat a human appropriate diet with natural food that God made, not that man made, your body is supposed to be able to utilize all of it, or at least most of it. Some of it does get thrown out as waste, but most of it gets utilized in your body. And you can only utilize it if you have the right stuff in your body to actually break it down into a usable form. Because you are what you eat. You're also what your mother ate. You're also what your grandmother ate.
And the recipes that they used.
And the recipes they used. So think about that. And if you need any help with your stomach acid, how to make it function, reach out. Let's see how we can help you.
Yep. It's an easy fix. We can take you by the hand. What seems like an absolute mountain to you, we can break it down into small little blocks and you can understand it and do it. It's all doable.
For sure. Okay, I think that is it for us for today. And Yvette, this was fun. I hope people listened. And if you're a thumb sucker, call us. Get in touch so we can see if we can help you.
We'd certainly love to help you and also see you thrive and have better results and throw one more prescription out or one more drug out the window.
And we hope this was a conversation that moved you from medicated to motivated. Take care.
For sure. Take care, everybody.